So a quick commentary on something that's come to my attention. If you've seen any of my videos before, you know that I stress that rhinoplasty is a surgery of building. The way that you get a really nice, pretty, refined nose, yes, even the smaller nose, is by building that specific shape, not reducing, not cutting away, not pinching. That's all it leads to these really fake results that nobody likes. But specifically in revision surgery, I see a lot of patients coming in for revisions, and one thing that always baffles my mind, I see some, they're on their second, their third, their fourth surgery, and any of the revisions, I ask, how was it done? What was used? There have been no grafting. I ask, was there rib grafting, ear grafting? Nothing. I do not understand, honestly, how you can do a revision surgery when there is no septal cartilage and just really everything is destroyed, essentially. I can't think of a different word. A lot of these surgeries are being done in a way that just cuts away cartilage. And so then what we have to do in a revision is rebuild. So of course they're coming in for yet another revision because their revisions weren't done adequately. So if you're going in for revision, if you don't have septal cartilage and they're telling you they don't need any additional cartilage, it's possible, but it's very rare. I would be suspicious. I would ask them, well, what are the things that we're doing? How are we going to do this? Do we need more support along the dorsum? Do we need more support around here? Because again, these are things that I'm seeing over and over again. And I really feel bad for these patients. They've had their primary surgery, then they had their one revision, then they had another revision. And in all cases, no one's ever bothered to actually build them a nose. They've just continued to reduce and reduce. So this is something you have to be aware of, whether it's your first surgery or if it's your first revision or your second revision, doesn't really matter. The concept of the nose, the way that you get the pretty shape, is you don't just keep cutting and cutting away. In primary surgeries, I rarely cut anything away, and yet we still get these really nice, pretty, small, medium, large, whatever noses we want, but we reshape the cartilage by using the patient's own cartilage or cartilage that's donated, like rib cartilage, in order to create those shapes.